Today, I'm talking about fat injection in the face. Fat injection in the face is, a 7 or 8, 10-year-old new concept. Any concepts in plastic surgery that are 10 years old, are really a new concept and things like that. Now, how did this come about? How this came about is we started to, some surgeons and things started to analyze the aging face, and we started to reevaluate the facelifts we were doing in the past, the blepharoplasty, the eye surgery we were doing in the past. In the past, we were taking a lot of fat out of the eyes, hollowing the eyes, trying to get a younger look. And what was kind of determined is that maybe we were going backwards when we were doing this. When we are young, we have a full round face. We have more volume, more fat in the face. As we age, we lose volume in the face. And so now the idea is, let's fill the face to the way it used to be when we were young. So now adding volume is kind of the key, the key to facial rejuvenation, to the aging face. You almost are behind the times now if you do a facelift and do not do fat transfer to the face along with your facelift. You are behind the times if you're doing a lower lid surgery and taking out more fat than you're repositioning. So now when we're doing lower lids and eyes, we want to reposition the fat. We're not trying to take it all away. When we're doing facelifts, we're adding fat to the center of the face along with our facelift and tightening skin and tightening the fascial layers. So that's the idea of the fat transfer of the face. I would argue that the fat transfer of the face may be more important or as important as the facelift. And here's the reason why. When we look at this patient here, this is a patient that is, got a good skin, a young person, useful person, but what we've lost in some of the fullness of the face. We have more of a flat face, more of a linear face. We have a long eyelid. We have the cheeks that are low and hollow. The face is just too flat. When we're children, we all have round faces, and that's the look of youth. Now, the other part of this story is the magic stem cells. Fat has a lot of stem cells, and we're getting some improvement with blood vessels. We're getting some changes with the skin, with the stem cells. And you can just see after the fat injection, the quality of the skin is a little bit better than it was before. So now you can see what we did with this patient was we did fat injection to the cheeks, the lower lid, the nasolabial folds. So we've taken this flat face and now we've given it some fullness and rounded it out by adding the cheeks. If you look at the length of the lower lid before, and now she has a short lower lid of youth. When we look at ourselves in our 20s, our cheeks are right up next to the pupil. They're not way down here. And so that's why this face just looks younger than that. When you fill this compartment, you fill the lower lid, you fill the cheek, you fill the nasolabial fold, you're given that look of youth. And again, if you look, the cheek is hollow. The lower lid is very long. Now we've got that short lower lid and the full cheek. So that is the idea of the fat injection of the face. This skin quality is better. This is just a younger person than this. This is 10 years of youth. Now, the big thing about the fat transfer is it's forever. When you add the volume and you do a fat transfer, what you're doing is a non-vascularized tissue graft. It is similar to a skin graft. If I had a 3rd degree burn a full thickness burn on my hand, I would take the top half of the skin from this hand and place on that on the open wound. The recipient side of the open wound would, as it heals, blood vessels would grow from the recipient side to the skin. If the skin gets a blood vessel, it lives. If it doesn't, it dies. And that is the same thing we're doing with a transfer. We're doing a liposuction, taking the fat from someplace else, the stomach or the legs or wherever, and then when we inject it into the face, as it heals, the blood vessels from the recipient site will grow into the fat cells. The fat cells that get a blood supply live, those that don't die. We expect about 60% of the fat we put in to get a blood vessel and give a permanent result. So once it takes, it's forever changed. So that's the big glory of the fat transfer. And I would argue for this lady, a fat transfer to the face is a better result than a facelift would have been. Because if you did the facelift without a fat transfer, the cheeks would still be hollow, the eyelids would still be long. And that's not the look of youth. And you can just see, this is just a younger look than that. You can see the fullness of the cheeks. You can see the wideness of the face. The face is rounder instead of flat and hollow. You can see the fullness of the cheek, the short eyelid. Look at the length of the eyelid. The eyelid is probably half as long as it was before the surgery. You know, the other side of the fat transfer is you have to do liposuction to harvest the fat. So if you want a small waist, well, there you go. You can liposuction, get a small waist, get a flat stomach, and then use the fat into the transfer. Now, the recovery from this, the most painful part of this is the harvesting zone for the liposuction. So that will hurt just like any other liposuction, but the infection in the face is just really more swelling. People don't really complain about pain in the face. It's just some throbbing and some swelling. Now, you'll be very swollen for 1 week, to 10 days, and it will look like, like you got hit in the eye. It'll just be very swollen. So most people need about a week off at the minimum after the surgery before they get back out because the face is so swollen. You will still be swollen at that week, but it'll be reasonable. It will probably take about 3 weeks to 6 weeks for all the swelling to go down, but maybe 3 months gives you the final look and you know exactly what it looks like. But, all in all, it is a very good procedure, makes a very good change. It is not very terribly painful. It's really the donor site and the pain from the liposuction donor site that you kind of deal with. But the fat transfer to the face, I think, is a very, very nice procedure, makes a very, very good change. I would still argue that it may be more important than the facelift, maybe as important as a facelift. And if you do a facelift, you should do the fat transfer with it. So I think this is really a growing procedure, and I just think it's something that a lot of people should think about. It can really work for you.